3, 2, 1. Good morning, everyone. Thank you for joining us. I'm Zack, the Planning Section Chief for the COVID-19 Haywood County incident. This is the Ops Period Briefing for Operational Period 6, 4/17 through 4/24. Our overall goal is to safely reduce the likely COVID-19 transmission in vulnerable populations while not overextending the burden to our existing comprehensive medical system in Haywood County. Displayed before you are our operational objectives for Ops Period 6. Those are to provide for the safety of the citizens, public, and first responders of Haywood County, to work closely with all county departments to compile all financial records related to the response of COVID-19. We are to exercise and refine all our contingency plans that have been created for a COVID-19 response. We're to develop a way and track the economic impact to Haywood County, with weekly reports being due to the policy group each Friday. We are to identify and implement measures to care for the basic needs of the impacted communities and citizens, especially the vulnerable populations. We're to develop and implement a plan to support the needs for licensed care facilities as well as other congregate living facilities. We're also to develop a plan to ensure adequate COVID-19 tests and processes are in place to accommodate the citizens' populations by 5/4. We're to identify the shortfalls in the general population and procure enough masks for the citizens for those who do not have them. We're to develop a virtual operations plan for our emergency coordination center for all those who are working there or potentially will be working there, no later than the end of this next off period. Displayed before you is our policy group. The policy group is there to give us our objectives in which we are to work on. The policy group is composed of the Emergency Services Director, the Sheriff, the Health Director, the towns of Canton, Clyde, Maggie Valley, Waynesville, the County Manager, and elected officials. Here before you is a comprehensive org chart. The org chart is our organization structure for the response to the COVID-19 incident. Our team lead is Travis Donaldson. Our safety officer is Jory Miller. Our liaison officer is Wayne Morgan. Our PIO is Allison Richmond. Our operations section chief is Cody Parton. I'm your planning section chief. Your logistics section chief is Travis Donaldson, and the finance section chief is Julie Davis. I'll now turn it over to operations to speak about what is going on in the operations section.
Good morning, everyone. Cody Parton, operations section chief. I hope you can understand me okay. We are wearing masks. We are practicing what we're preaching. The operations section is here to help coordinate the unified response to COVID-19 and provide support to everyone in Haywood County. We will accomplish this through a one team, one mission, one family approach. We are currently in the 5th week of coordinating the Haywood County response to COVID-19 and moving into the 6th week. As we continue to coordinate this response, don't lose sight of the main goal of life safety by limiting avoidable disease transmission. We will get through this together. The current operations, we are maintaining and have updated our comprehensive organizational structure to meet the needs of the citizens. We have formulated multiple contingency plans based on objectives given and have been exercising the plans and will continue to do so. We continue to have good, effective communication with all units in the operations section. Situation update reports are being issued on Monday, Wednesday, and Friday evenings. We continue to do research along with medical experts on obtaining pertinent and crucial information for plan establishment and public releases related to COVID-19. We continue to strengthen our working relationships with all the partners involved, utilizing a one team, one voice approach. We have reached out to all of the long-term and licensed care facilities to ensure they have the most up-to-date guidance provided from the state, and we're also addressing their critical personal protective equipment needs. Moving on to the future objectives for operations period 6 that are for the operations section. Exercise and refine all contingency plans that have been created in response to COVID-19 by 4/24. We're in the process of exercising and refining all the contingency plans and have currently exercised multiple plans. The next objective is to develop a way of tracking economic impacts to Haywood County, with weekly reports being due to the policy group each Friday starting on 4/24. The Economic Impact Task Force is working hard at obtaining an economic report in reference to the impact that COVID-19 has had on Haywood County. The next objective is to identify and implement measures to care for the basic needs of impacted communities and citizens, especially the vulnerable populations affected by our county proclamation requirements. The Community Response Task Force is communicating and providing services to the impacted communities and citizens affected by our proclamation requirements. The next objective is to develop and implement a plan to support the needs and functions of licensed care facilities, as well as other congregate living facilities, to limit virus transmission by 4/24 to help cover shortfall due to gaps in normal supply chain channels. We have a licensed care facility task force in the public health group that is ensuring we are caring for the facilities to limit COVID-19 transmissions with the most up-to-date guidelines and assisting with their logistical needs. The next objective is to develop a strategic plan to ensure adequate COVID-19 tests and processes to accommodate our citizen population by 5/4. The Testing Site Task Force will be working on creating an effective plan to ensure adequate COVID-19 specimen collections to accommodate the citizens of Haywood County. The last objective is to identify the shortfall in the general population and a procurement strategy for citizens without mask. Develop a mass distribution plan for the mask along with guidelines for proper usage by 5/4. With the Public Health Education Task Force, in conjunction with the public information officers, we'll be working on a means to evaluate the current use of masks by our general population. The operations section will be forming a plan for distribution of the mask and the proper guidelines for use once we're able to obtain more masks by working with logistics. Next, I'd like to go over briefly the organization chart for the operations section. I have a Deputy Operations Section Chief, Bill Miller. We have a Health and Human Services branch led by Branch Director Ira Dove. Under that branch, we have a Human Services group and a Public Health group. The next is our Continuance of Operations group, which is led by Crystal Patterson. We have a Law Enforcement group, which is led by Don Robertson, a Fire Services group, which is led by Daryl Henderson, a Community Support group, which is led by Mike Street, and a Medical Services group, which is led by Ben Clausen. I would next like to go over the contingency plan table of contents just briefly. You have those before you. You see the plans, all the various ones right there, and who the response coordinator is for each individual plan. I encourage anyone that has any questions or concerns or would just like to review the plans to please reach out to us. You see my information there at the bottom. Please don't hesitate to contact the operations section, and we will try to accommodate you in reviewing these contingency plans as best possible. Thank you.
Good morning. Joey Miller, Safety Officer. I'll be going over the 206 medical plan as well as the 208 safety message. On the medical plan, the County Wellness Center is requesting that you call before coming to the clinic, and they currently do not have the ability to administer tests for COVID-19. On the 208, or the safety message, the role of standard precautions is going to be discussed. According to the CDC's guidance for the selection and use of personal protective equipment, or PPE, standard precautions are intended to prevent the transmission of infectious agents. As a result of that assumption, appropriate precautions should be taken. These include hand hygiene and proper donning, use, and removal of gloves, gown, mask, eye protection, or face shield. You can note the screen before you or reference your safety message in the IEP for recommended proper procedures. Thank you.
Good morning, everyone. I'm Travis Donaldson. I will be your Logistics Section Chief for Haywood County COVID-19 for operational period 6. The Logistics Section is utilizing electronic resource request form to allow for streamlined requests coming from each of the sections of the team. Each section, please let your groups and branches know that for any resource request, they must utilize the electronic request form. Please utilize a new form for each item or service that you're requesting. Completing these 213s also allow us to track our expenses as a single purchasing point. A QR code has been made available within your IEP for you to scan and download the electronic form. Personal protection equipment, as many of you are already aware, is still a scarce commodity due to the unprecedented demand on stockpiles and production globally. Our logistics section has been managing our central receiving and distribution point and prioritizing orders that come in via your request forms. Currently, we're operating off guidance for prioritization methods issued by the state. We're doing our very best to meet everyone's needs. At times, this will mean the agency doesn't get the full quantities that they are requesting. To date, our logistics section has filled 150 local resource requests to 120 agencies, including healthcare facilities, long-term care facilities, law enforcement, public health, and agencies providing essential humanitarian relief efforts. Our logistical staff has been working constantly to find outside-the-box solutions to make sure that we're finding resources to provide the best protection for the teams helping to fight and respond to COVID-19. Please refer to your 205 for any section communication needs or questions. We're utilizing Haywood Alerts and Haywood internal alerts to push important information out to our responders and the citizens. Within the logistics section, we have Johnny Reese, who is our Deputy Logistics Section Chief, who is also managing our CRDP. Steve Maciano is our IT Unit Leader, Andrew Messer is your Communications Unit Leader, and Adriana Warrington is your Supply Unit Leader. Julie Davis is our Finance Section Chief, with Ed Salim as the Deputy Finance Section Chief. Christian Owen is your Grants Portal Manager. Please track your time and activity via your 214s, as well as tracking vehicle mileage and use time, as well as equipment use time. Track all expenses, receipts, and packing slips for each ops period, and submit to Ed Salim, your Deputy Finance Section Chief, by Monday at 2 p.m. following each ops period. Thank you, and if you have any questions, please let me or a member of our section know. Thank you.
Hello, I'm Allison Richmond, Public Information Officer. Our key updates for this week are that we have a total of 4 COVID cases identified in Haywood County, 3 of which are considered recovered at this time. We're under new restrictions for retail stores, limiting the number of customers allowed inside at any given time. Please, when you do shop, follow the guidance there and maintain social distancing at all times. We want to let you know that as of April 20th, which is this coming Monday, the new call center hours have been adjusted to Monday through Saturday from 8 a.m. to 6 p.m., and they will be closed on Sunday. The hotline number remains the same, which is 828-356-2019. As always, we ask that you look to and share reliable local information sources, including the haywoodcountync.gov website, the Facebook pages Haywood County NC Government, Haywood County Health and Human Services, and Haywood County Emergency Management, as well as those of local media and their newsletters and coverage. Also continue to look for Dr. Mark Jabin's daily video messages. He's been doing a great job explaining some of the intricacies of this event. Please continue to practice patience and kindness with each other. We're doing great, but we're not in the clear yet. We want to remind everyone to stay the course, stay home, and stay well. Thank you.
Wayne Morgan, Liaison Officer. We're well into this COVID-19 response effort. The citizens of Haywood County have done an outstanding job of helping to contain this virus to date. Agencies, organizations, and businesses that participate in response efforts as well have done excellent jobs in providing for the citizens of our county, as well as preparing contingency efforts for the surge. We have 126 different agencies and businesses contributing to the effort. Volunteers are out there putting in countless numbers of hours. Everyone is doing an outstanding job to this point. We're looking better, but this is a nasty virus. Please do not become complacent in your efforts to contain this virus. Keep the proper lines of communication moving so that we can maintain a common operational picture. Again, if you are not in the communications loop, are not receiving information, let myself or Andrew Messer know. You can find our information on the slide. Take care, wash your hands, maintain social distancing, and stay at home. Thank you.
Good morning again, everyone. I'm Travis Donaldson. I'm your incident management team leader. I would like to first thank everyone that's a part of this response. The amount of selfless acts of caring and assistance that is ongoing is just as unprecedented as the virus itself. There are so many people doing extraordinary things that have a common goal of protecting and assisting our citizens. As with any incident, communication is one of our major keys to success. I want to emphasize to everyone that as part of this response that we must communicate with each other and we must communicate well. We also must communicate well with the citizens that we're protecting. We have to be concise and consistent so that everyone knows what they should be doing or not doing to continue to slow the spread. Please follow the chains of command within your section to ensure that the tried and proven processes allow us to succeed on all fronts. If you have any questions on the structures and processes, please don't hesitate to ask anyone on our IMT staff. I want to again emphasize our overall goal for our response to COVID-19. We want to safely reduce the likely transmission in vulnerable populations while not overextending the burden on our existing comprehensive medical system of Haywood County. Life safety by limiting avoidable disease transmission must be the highest priority to limit serious illness and death within our county. As I stated in our last ops period, the next few weeks are still very crucial in our efforts to minimize the spread of the virus. As a team, we need to be reviewing and exercising the plans that we've worked so hard to develop over the past month. Our area is very fortunate considering that we've had several more weeks than other areas of the country to prepare and plan, so let's continue to make good use of the time that we have. I would like to conclude today's operational period briefing with a quote from Professor Nancy J. Alder from McGill University. Artists and leaders face similar challenges. To see reality as it is, without succumbing to despair, while imagining possibilities that go far beyond current reality. To have the courage to collude against illusion while articulating possible future previously unimaginable. And to inspire people to surpass themselves individually and collectively for the benefit of all. Thank you to everyone for your tireless efforts over the past 5 weeks. Good luck and Godspeed. Thank you.